Hello and welcome. On this video, I'm going to be discussing a technique that you can use to alleviate a lot of common knee pain issues that people tend to get. And the caution here is, as long as there's not any actual damage to the ligaments or the tendons of the knee, and it's not severely arthritic, usually this will help a lot of the just kind of the nagging, aching, sore spots, and maybe it hurts when you go up or downstairs, that kind of thing. It helps quite a bit, but definitely rule out any type of internal knee damage before you do this type of technique, at least as far as the stretching part of it goes. So let me go into the technique, and I'll discuss that a little bit more as to when not to do this as we go along. So let me go ahead and change camera angle just a little bit, and we'll go from there. All right, so here we have a knee. And a lot of times you'll get soreness and sometimes even popping and snapping and that kind of thing as you move the joint around the kneecap. And that's mainly the area that this is intended to treat, is soreness and pain around the kneecap area. If you're feeling it deep in the joint, probably this is not a good idea for you to try until you've had it checked out by a professional. Make sure there's not any internal damage there that you're likely to aggravate. But if it's mostly right around the kneecap, you haven't had any particular trauma to the kneecap, this is fine to do, and a lot of times it'll provide a lot of relief. So a lot of times what will happen is you'll get these areas of contraction. You'll feel little knots and stuff kind of right along the edge of the kneecap, and it can be on the inside or the outside, and you just kind of push around in there, see if you find any little knots and little tender areas. And when you find them, what you're going to do is you're going to basically rub parallel to the leg, so the movement is in this direction. You just kind of get a fingertip or two on there. If you got really strong fingers, one's usually adequate. If you need a little more support, you can use a couple of fingers there, or you can use your thumb if it's a little stronger. And you're just going to get in there and you're going to rub back and forth on it several times. And you search around, see if there's any others in there, kind of find whatever spots you have on, again, on both the inside, and then come around to the outside of the kneecap, same thing. Look around and poke on spots, see if there's anything that's sore. And then you're gonna, if you find something, you're gonna just rub, parallel to the leg to try to loosen that up. And once you've rubbed on it, for several passes back and forth on there, then you're gonna stretch the quadricep muscle. And you can do this several ways. I'm gonna show it lying down just because it's easier to do this without switching the camera angle too many times and switching position. But if I'm going to stretch this leg, I can turn onto my stomach and just kind of pull my heel towards my butt. And you hold that for about 20 seconds or so. And for the sake of brevity in this video, I'm not going to wait the whole 20 seconds. Then come back up. And again, you're going to check for tight, sore spots along the edge of the kneecap. And if you find any again, just go in there, rub on them like before, go back and forth, find whatever ones you find in there, inside and outside of the kneecap. Go back. And if you have trouble, bending your knee to where you can grab it with your hand, you can use like a loop of cord or something like that. You can use a towel, something like that, wrapped kind of around the leg, and then pull it as far as you can get it. You don't need to pull it all the way up to the buttock. Just pull it as far as it goes, as far as you can comfortably get it. And then again, you go back, you search for the points, find any, you rub them back and forth, you stretch again. And you basically keep going until you don't find those sore spots anymore. And it doesn't have to be done all at one time. You can, come back to it, do some of it one day, come back to it another day. usually you'll have maintained at least some of the loosening effect on it. And as you kind of work your way through all those little tight points, then the knee starts to feel quite a bit better in most cases. So that's it for this tip. I hope you found it useful, and I'll look for you on another video. Thank you for watching.